Metformin and PCOS. These two combinations are like two sides of a coin. Every individual who has a PCOS is mostly prescribed metformin medication. What is metformin? How it works and what are the benefits? That is what we are going to discuss in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now before I continue, one important information. If you want to watch this video in Hindi language, then on the I button and below in the description box there is a link. If you click on that link, then this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. जैसे ही आप उस लिंक पे क्लिक करेंगे इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's continue our today's topic, which is a part of our PCOS series, and today we are going to discuss about the metformin. So what is PCOS? First of all, understand that. PCOS stands for Polycystic Ovarian Syndrome. It is one of the most common hormonal imbalance related health problem. It happens to women due to disturbance in a male and a female hormone. Up to an extent, PCOS is considered a lifestyle health problem also. The root of the PCOS is insulin resistance. So the moment we correct the insulin resistance, it starts showing improvement. Alright. Now let's understand what is metformin. See, metformin is a drug, it is a medicine, and its generic name itself is a metformin. It is available by plenty many brand names across the globe. Okay. And this metformin falls into a category of a drug called as a biguanide. Metformin drug is basically used for the treatment of a type 2 diabetes, and it is one of the oldest medication which is used for the treatment of the type 2 diabetes, and it is one of the very safe and effective drug. Metformin medicine per se, it functions like an insulin sensitizer, means it improves the sensitivity of the insulin hormone, which is completely opposite to that of the insulin resistance. You remember I told you that insulin resistance is the root of the PCOS. So if we reduce this insulin resistance, we find a lot of improvement in your PCOS, and that is what it does. That means metformin reduces the insulin resistance. This metformin medicine is available in a various different dosage. Starting with the 250 milligram, it can go all the way up to 2500 milligrams per day. What dose will be right for you? Your doctor will be the right one to advise you. Now let's understand how this metformin medicine works. So see, first way it works is that it acts on your liver. And this, when it acts on the liver, it reduces the production of the glucose from the liver. It also reduces your body's carbohydrate content, and it reduces the insulin resistance, and it maintains the insulin and a sugar level. So these are the various methods by which the metformin medicine works in our human body. Right? Now let's understand what are the benefits when you are put on the metformin medicine. See, metformin medicine, as I told you earlier, that it is one of the most commonly prescribed medicine for the PCOS. However, we also use it for the diabetes treatment also. So what are the benefits? So the first benefit you will experience that the root of the PCOS, that is the insulin resistance, it starts bringing down. So your insulin resistance decreases and your insulin sensitivity increases. And while doing so, it also reduces your blood sugar level, and thus it prevents the further coming of the type 2 diabetes. By the way, Type 2 diabetes is one of the very common complication of PCOS. So when you are put on this medicine, it prevents you from going into a full-fledged diabetes, right? When the PCOS patients are put up on this medication, they find a lot of improvement. They find that their monthly cycles become more regular. The cycle becomes ovulatory, means they start ovulating. And because they start ovulating, their chances of conceiving and getting pregnant in the future increases. Means we can say that metformin can increases your fertility also. In fact, when we give metformin during even the pregnancy, especially to PCOS women, it reduces their chances of miscarriage and abortion. Recurrent and a repeated miscarriage is again very common complication seen in a PCOS women. So when metformin is given, this complication also reduces. Another issue with the PCOS women is that when they get pregnant, their chance of getting a gestational diabetes, what we call it as a GDM, is very high. And when these women are given metformin, their chance of getting into GDM also reduces. Besides that, if a woman has a symptoms like acne or excess of an unwanted facial or a body hair, they also start showing lot of improvement when the metformin medicine is given. Another thing is that when a PCOS woman is struggling with the fertility, and many of the times they undergo a treatment like an IVF, in vitro fertilization, which is a part of our assisted reproduction. And in that certain medications are given, and due to those medicines a very typical condition happens, what we call it as a OHSS, that is ovarian hyperstimulation syndrome, and that can also cut down when you take a metformin. That means metformin has a many benefits when it is given to PCOS women. However, metformin medicine has to be taken in a correct way, then only you will get a maximum benefit out of it. And how to take this medicine correctly, I have made another video. You can watch that video so you will understand. And also, metformin medicine, when you take, you need to have few precautions. And if you don't take those precautions, you can land up in trouble. So what all precautions you need to take when you take metformin, I have made another video. You watch both of those videos so your understanding with the metformin and PCOS will be much clear. Alright. I hope after watching this video, you got some good useful information. If yes, please click on the like button. If you are new to my channel, please subscribe to it so that you don't miss out on any of the health related, especially hormones related information. If you have any of your personal question whose answer you are seeking for, write a question below in the comment box. I try to read and answer them as early as I can. We will meet again with some good new useful information. Till then, take care of yourself. Namaste.